Hi everybody, welcome to this video. I wanted to do a quick video here on the medical treatment of hypertension and the types of different medications that can be used. So in the first bracket here, we have initial therapy. So within initial therapy, what you'll see is that, let's see, what is it speaking here? Sorry about that. So this is going to be a review video on how to remember these. It's sort of a mnemonic video, I guess. And so what we start with is initial therapy. So start with initial therapy. So initial therapy is going to be thiazide diuretics, ACE inhibitors, angiotensin receptor blockers, or CCBs. But in African American patients, you want to use thiazides or CCBs first line. So the way that I remember that is by thinking about African American patients. So let's find an African American. And so here's my African American person. And let's just say that this person has some hair and some eyes as well. And so the way that I remember the thiazides is the Thor hammer. So I think of thiazides and I think of Thor. And then I draw a little Thor hammer here, and that helps me to remember that. And then I also draw for calcium channel blockers, I think of calcium, and that reminds me of milk. So in one hand, I draw a calcium or a Thor hammer, and then the other one I draw a glass of or a bottle of milk. So that's how I think of. So I think of like a really, really like muscly type of person, like the Thor guy who likes to get calcium and then likes to get built from drinking a lot of milk and having a Thor hammer, I guess. So the next one is going to be the the next one is going to be chronic kidney disease. So chronic kidney disease is going to be ACEs or ARBs in combination with other drugs. So let's just draw out a kidney here. And then I just remember like ACE inhibitor or ARB. So just think of like blockers on top of like the kidneys, just to try to jog your memory and remember ARBs or ACEs. MI, you can think of beta blockers or ACEIs in terms of medications to give because these decrease mortality. And so I always remember this as like a broken heart. So that just reminds me of beta blockers. I think of broken hearts when I think of beta blockers for some reason. Um, and then ACE inhibitors. So I think of the ACE inhibitor as like a band-aid on top. So there's like a little band-aid here that goes on top of the broken heart. So here's this. So that's just to remember that there are two different medications to give, or that you can start off with. Next one is osteoporosis. So osteoporosis, you want to think about people who need to keep in their calcium levels. So if they need to keep in calcium levels, then what do you want to give them? You want to give them thiazide diuretics. So the way to remember that is um, you can think of, I think this is a hard one, but I think of osteoporosis and then I just link it all together. So there's like the MICCH drugs. So metalazone, indapamide, hydrochlorothiazide, chlorthalidone, and chlorthiazide, or chlorothiazide. And then these ones all in combination are diuretic diazides. So I think of Mitchy Mouse, like Mickey Mouse. So I, I'll draw this little picture of Mickey Mouse here. That's Mickey. That's supposed to be Mickey Mouse here, so we'll just make these ears really like obvious. And then so we think about Mitchy Mouse. So that's to help you remember MICCH. So metalazone, indapamide, chlorthalidone, and then chlorothiazide and hydrochlorothiazide. So chlorothiazide and hydrochlorothiazide, just remember they're both basically the same. One has hydro in front of it, and then chlorthalidone is the next one. So for pregnancy that's the next condition. So you want to give methyl-dopa for patients who are pregnant. And then we have one more area to go over here, and that's going to be patients who have CHF. So patients who have CHF, you want to start off with medications such as ACE inhibitors, ARBs, beta blockers, or potassium sparing diuretics. The way that I remember the potassium sparing diuretics are T's, so TEAS, triamterene, amiloride, eplerenone, and spironolactone. So the way that I remember a CHF, so I think of um, a heart that wants to make some tea. I don't know why. I think of like a blue heart when I think of CHF because it's congestive heart failure and patients can be cyanotic. So blue heart wanting to steep or make some teas. Okay. And that's how I remember these medications. I hope that helps. Please let me know. Leave a comment below, hit the like button, and subscribe for more videos. Thank you. Bye.